Hi, thank you for joining us. I'm your host, Nada Youssef, and today we're back with Cleveland Clinic family physician, Dr. Donald Ford. Happy to have you back.
Thank you.
This time we're here to talk about cold, fevers, and the flu. We will also be taking your live questions in the second half of this broadcast, so if you guys have any questions, please leave it in the comment section below. And before we begin, please remember this is for informational purposes only, and it's not intended to replace your own physician's advice. So, since it's flu season, I figured you'd be a perfect doctor for this Facebook Live. I also have some flu facts that I wanted to read out loud for our audience. The flu may cause cold symptoms, but is a serious disease that can be fatal even for healthy people. The flu virus changes every year, so getting vaccinated yearly is very important. And the flu virus, can survive on heart surfaces for 48 hours. Is that true?
That's true. That's
a
all true.
long time.
Yep.
And then the viruses used in flu shots cannot cause the flu. And I know I hear a lot about that.
100% correct. Yeah.
Good. Well,
Yep.
let's go ahead and just kind of start with the difference between a cold and a flu.
It's a great question, Anna. There are literally dozens of different viruses that are around us, especially during the wintertime, that can cause cold and flu-like symptoms. Now that's a big category because a lot of them, there's a lot of gray area between what's what. Some of these more benign viruses, we call them adenoviruses, arboviruses. There's a handful of other ones. We don't actually have testing for them, so we don't really know 100% of the time what exactly is causing your upper respiratory symptoms. But they're all viruses. They all have in common that they cause inflammation of the mucous membranes, and they run about anywhere from 3 days to a week typically, and then they clear out.
So both cold and flu are 3 days to a week?
No, so that's the cold. So that's for the cold.
Okay.
There's one particular family of viruses called influenza, and those are the viruses that cause the flu. Now that is a more serious thing. It's typically characterized by a high fever. It can be a very serious illness, as you said. So even for healthy people, the flu can be a dangerous thing.
Yeah.
Historically, if anybody is a student of history, you might know that in 1918, which was just before the First World War, there was an outbreak of influenza across the world. It killed 18 million people worldwide. We haven't seen anything like that since then, thank God.
Yeah.
But we can't forget that last year in the United States alone, 80,000 people died of influenza. So it's a real serious thing.
Sure.
Colds we can deal with, we can talk about, and I love to talk about what the difference is so people understand what's going on.
Great, perfect. Well, let's talk about when you're most contagious, because that's an important one.
This is a tricky thing about viruses because the most contagious time for any virus is before you actually get sick.
Oh.
So that makes it really difficult. So you know, how do you know? Well, I've been around people who have been sick. They've been sneezing on me. You know, perhaps we've been shaking hands and stuff. In those first 2 to 3 days before the symptoms start, you're actually developing and starting to shed the virus. So in my world, where I go in and see a lot of people, some of whom are sick, some of whom are okay, that's why I wash my hands every time.
Yeah.
It's partly for my own protection, but it's also for your protection, because I don't know if a person I saw 2 days ago was sick with a virus, gave me a virus that I haven't even started to get symptomatic from, and I can communicate it to you. So you see doctors, nurses, healthcare workers always washing their hands. That's the real reason why.
And you're saying that you can get the virus in your system 2 to 3 days before you feel anything.
There's usually a period of anywhere from a few days to even a week with some viruses before you even feel the first symptom, where you're actually starting to develop the virus and develop the immune response in your own body.
And then you're contagious the whole time until you're completely
typically
off your
with a
system.
couple of exceptions. Now one of the things when we'll talk about this, I know, in a little bit, but there is medication that we can prescribe for influenza. And after you get the medication into your body, that typically stops the reproduction of the virus, so you may not be as contagious after starting medication specifically for influenza.
Okay, great to know. Okay, so let's talk a little bit about fevers, because that's kind of like the scary part. So what causes a fever, and what is actually happening to my body when I'm feeling really warm?
So a fever, we talk colloquially, we talk around, anytime you feel hot, you feel warm and sweaty, that's a fever. Now in medicine, we actually, we quantify that. So a fever has to be 101 degrees or higher. And the reason we put that kind of specification on it is because we really see that there's different meaning for temperatures that may be above normal, but not quite up there. So what we call low-grade fever may actually represent a different set of illnesses than something that gives the high fever.
Right.
High fever is characteristic specifically of influenza, and we'll get into that more. What's happening in your body is it's actually part of the body's immune response. So we think of fever as something bad, and of course we want to bring down the fever, and people will put on cold packs, and people will even stand in the shower. Of course, we give Tylenol or anti-inflammatory medications, all of which are designed just to bring down the fever. They may have other effects like muscle aches and things like that. But having a fever is very uncomfortable. But the funny thing is, it's our own body starting to fight off what's invading us. So if a virus gets into our system, it's in the mucous membranes, it starts to show up in the bloodstream, our immune systems release chemicals called bradykinins and other types of inflammatory chemicals that actually start to increase the heat in the body, start to increase our core temperature. And part of what happens is it makes it very uncomfortable for the virus to live. So we're literally trying to cook the virus out of our bodies.
Wow. So our body's actually fighting off the virus when
Correct.
this is happening.
Yep.
But when is it like, okay, this is enough of this heat that's happening in my body, I need to see a doctor?
Well, that's part of it. So it can be very uncomfortable, and we do recommend that you take something like acetaminophen, which is Tylenol, or anti-inflammatory medications to bring down the temperature. Part of the problem is you can get dehydrated really easily.
I see.
So when your body is that warm, you're sweating more, you're releasing more fluids, you're releasing it through your mucous membranes. People with a fever, if you haven't noticed, they tend to go to the bathroom more.
Yes.
So you lose fluids. You gotta
Drink a lot of water.
keep drinking a lot of water.
Okay.
And it's also a smart idea to do something like take some medicine to keep the fever down.
Okay.
So how do you know when to go to the doctor? Well, we use that cutoff really as 101. If you're just looking at the fever, below that you're probably okay. Above that, definitely should get checked out.
Okay, so if your fever is over 101, go see a physician.
Yeah.
Okay, now go
Now,
ahead.
there are other things too,
Yes.
because in terms of what I just said, you want to make sure you're able to keep up on the fluids. So if you've got a lower temperature than 101, but you're throwing up, you're not
Can't
able
keep
to
it in.
drink, can't keep things down, can't take that Tylenol or that Motrin, that might be a good time to go see the doctor as well.
Okay. What about for kids? Now, when my kids get a fever, that's like the world kind of ends for me. And again, sometimes you call the physician or the nurse on call, and she tells you if she's not throwing up, if she's fine, she's not dehydrated, let her go through the fever.
So kids tend to get higher temperatures than grown-ups. Their temperature is going to go up much faster and down much faster. Now, there are things that we have to watch out for, which is super fast elevation of temperatures in kids. It's possible, it's very rare, but it's possible that can actually cause a seizure in some children. So we are telling parents to really do what you can to keep the temperature down. You want to moderate it. You don't want that temperature to shoot through the roof. But on the other hand, the temperature by itself isn't the criterion. What I said before and what you said are really what's important. Can they keep down fluids? Are they eating? Are they drinking? You see a kid, he's got a temperature of 102, and he's sitting there playing with blocks on the floor and looking happy and smiling at you.
Just leave him as
That's
being-
an okay kid.
Yeah.
Yep.
Yeah. Okay. And if they can't keep it down and they're having issues, is 101 still the magic number for kids as well?
It's a cutoff. So I'm actually hesitant to say that's the magic number because again, really what it has to do with is much more of what I described about overall behavior and energy level, attentiveness, responsiveness, that sort of thing.
Okay.
So, but that's when you talk about what we call a fever, that's what doctors call a fever.
Right. Okay, great. Now I want to kind of give you symptoms that people get confused
Want
with.
to give me symptoms?
I'm going to give you those
Oh,
symptoms.
all right, okay. I thought this was a
I'll
friendly
read
place.
off these
All right.
symptoms to you, and then you tell me if it's a cold or flu, because I think a lot of people get confused.
Very good.
And then you can tell me how it feels for a cold or for a flu. So let's start with the fever.
Okay.
Is it a cold or a flu?
Okay. Can't tell. Now,
Can't tell.
but when I defined a fever as being over 101, that is much more typically seen with influenza. So that really should be in the flu. But when we talk about these low-grade fevers and stuff, you can get that with any virus.
You can get that with just a cold. You can get a fever.
Yeah.
I always thought if you had a fever, it's definitely the flu.
Yeah.
Okay.
There are other things that that can cause fever as well, mononucleosis and ear infections, strep throat, that sort of thing. That's
right.
sort of out of the stuff that we're talking about here today. But I would never say it's just the flu. But if you're going to compare those two, more likely the flu, less likely a cold.
Okay,
Yeah.
great. How about headaches?
Characteristic of influenza, very common, and can occur with colds as well.
Okay. How about general aches and pains?
That can occur with both. It's often related to the fever, so you'll see those going hand in hand. Worse with the flu, but still possible to be present with the cold.
Would you say that's the same thing with fatigue and weakness?
I would say so, yeah.
Okay.
Yep.
How about like stuffy nose, sneezing, sore throat?
Now, that's a good one, okay? So stuffy nose, the nasal congestion is almost always the cold, not the flu. So the flu doesn't cause you to be congested. And that's something we can hear talking to patients on the phone. They're coming in and you say, I think I've got the flu, I'm sneezing, I've got a runny nose. I can tell just right there it's probably not the flu.
Very interesting.
Now I can't tell you exactly what it is, but I can tell you it's unlikely to be influenza.
Okay. How about any chest discomfort or coughing?
Coughing is entirely characteristic of influenza, but it can occur with colds as well.
Okay.
Now, as an interesting thing, because we didn't really talk about this, but with the sore throats, one of the things that we listen for as we're talking to people about their symptoms, if you have a sore throat and a cough, probably not strep.
Okay.
Sore throat without a cough, very likely could be strep.
Very likely could be strep if you have a sore throat and not a cough?
Yeah, but you still have to come in and get a test, get a swab.
Very interesting. Okay. Okay, good to know. Now, how about like other complications, especially with kids, that can cause a fever? I know you talked a little bit about that. Like, can we talk about RSV, what that is, and the complications?
Yeah, I'm not sure if I can say it, but I'll try.
Yeah, that's why I gave it to you.
RSV stands for respiratory syncytial virus. Respiratory is the breathing system. Syncytia is a Latin word for the tissue of the lungs itself, and of course, a virus is a virus.
Right.
RSV is very common, both in adults and kids, but most adults have been exposed to it enough that they don't get sick from it anymore. Okay. So we typically see illness from RSV more in children than in adults. Now, the illness caused by RSV is a respiratory illness by the name of the virus. It's in the chest. That it has that in common with influenza. Typically causes a more barky cough or wheezing.
Okay.
And the treatment for it, they will often give an aerosol treatment of something called epinephrine, which tends to help that. RSV is usually a pretty brief illness, 2 to 3 days. By all means, I've seen cases longer than that, and you can get complications from it. If a child is really sick with it, they can be in the hospital even longer.
Right.
But for the most part, it's a 2 to 3 day illness, which is briefer than what we usually see with influenza.
Okay, and then with strep throat, I know we talked about this a little bit.
Strep throat is the odd man out of everything we've talked about today because strep throat is caused by a bacteria.
Okay, I see.
Very few upper respiratory symptoms are caused by bacteria. And that's a good thing because we're covered with bacteria. Bacteria is all around us in the world, every place we touch, everything. If these bacteria were causing us illness, we'd be in trouble because we're exposed to them constantly. Most of them just live with us perfectly, peacefully, and don't cause any symptoms. Strep is a family of bacteria, and one member of that family, group A strep, is the one that causes strep throat.
I see.
And it does go from person to person, which is actually fairly unusual for this, for bacteria that cause illness. So we do have to watch out for it. I already told you a couple of the things that we look for. So almost always characterized by sore throat, and almost never by cough.
Interesting.
Now it can cause a fever, doesn't cause the stuffy nose. So a few things in there are enough to help us start to distinguish. But we really do encourage folks to go in and get a rapid strep test. We can do it right in the office.
That's the only way you can find out if it's strep is if you go to the doctor's office and get the swab.
Test, yeah.
Right. Okay.
Because as much as I've said that, strep is sort of the odd person out and it's an unusual bacteria,
Right.
people who come in with sore throat and fever, 90% of them, it's a virus and it's not strep.
Very interesting.
So, yeah.
Okay. Let's talk about ear infection or teething. Especially, obviously, we're talking about kids here because it can have a lot of the same symptoms as a fever. So how could you tell if someone has a newborn or an infant?
It's tough. I'm the father of 3, and I remember when my kids were little, and that was actually before I became a doctor. So you'd look at them, boy, is he tugging on his ear?
Yeah.
That sort of thing. It isn't an easy call because some kids don't seem to be pulling on their ear at all. And, unless you're qualified to look in somebody's ear, it's really hard to tell. As a doctor, I can look in a kid's ear quickly and know if it's an ear infection or not. We usually look at the overall comfort level of the child. Same things I talked about before. Are they eating? Are they drinking?
Okay.
And a very important thing with ear infections that's a relatively new discovery. We've always treated them with antibiotics. Kids will get over ear infections without antibiotics if you let them, most of the time.
Yeah.
And, I'm giving a lot of qualifications in there because there are all sorts of reasons why, maybe the kid is really not looking well and you really want to do something to help them. Or maybe there are other people in the house that you want to protect. There are all sorts of reasons why you would go ahead and treat, but we always want to give the parents the option. If you're comfortable with this, we can just watch this young person.
How long
see.
is an ear infection usually?
3 to 5 days.
3 to 5
a
days.
lot of the times. Now that's one of the things we'll do. We'll say watch him for 3 to 5 days, and if he does okay, maybe we don't need anything.
Okay.
If he's still sick after a week, maybe call me. Or a lot of times I'll just give people a prescription and print it out, not sent electronically.
Until needed.
Yeah, so hold on to that and see if you need it.
Very good.
Yep.
Okay, so besides kids, they're still building their immune system. Who else is at high risk for developing any kind of flu complications?
So from the flu, the people that we worry about the most are the young and the old. So people over 65 and children, young children. People over 65 are more vulnerable to disease. I don't want to say it's because they're lacking the immune system. It's really just it's an effect of aging that you're just more vulnerable.
Right.
So as an older person gets secretions in their chest, they may have a harder time clearing them. They're just, they have less body fat, so less storage of nutrients and so forth. So they can get dehydrated more easily.
Right.
So those are part of the things that we see in the elderly. And also just somebody with a lot of chronic illnesses, perhaps somebody with heart disease or lung disease, they're just going to be more vulnerable.
Sure.
So, again, it's not to try to scare people at all, but, we did see a lot of deaths in the United States last year from the influenza, and most of them were the very young and the very old.
I see. Yeah, because it sounds like we take the flu shot. You wouldn't think that many people are still dying from this disease.
Yeah.
So let's talk about prevention and treatments. How do you treat the cold versus the flu?
Yeah. Well, the treatment for a cold is entirely supportive, and what that means, another way of saying that is symptomatic treatment. So you just try to give people suggestions for things that they can do to help the symptoms because it's going to run its course. It doesn't matter what you do. If you've got the cold, if you've got an adenovirus or one of the other viruses that cause colds, we don't have any medicine that can make it go away.
The cold. So we're just treating the cold, the cough or sore throat or something like that.
So cough medicine is perfectly legitimate to give. There's a lot of good ones that are over the counter.
Yeah.
There are ones that can be given by prescription. I have a couple of things that are not narcotics. The narcotics I typically I'm a little cautious with that. We know everything in the world is that the dangers of narcotic medication. So I do try to stay away from that wherever possible.
Right.
But sometimes if somebody really can't sleep is very helpful to get over an illness.
Right.
So I don't, I'm not going to not prescribe something if it's going to help them sleep.
Sure.
Decongestants are another thing for treatment, and here's the one that I am a huge fan of: Saline Spray.
Okay.
Because you can get that for just a few bucks, or you can even whip it up in your own kitchen with just a little salt water and salt and water mixed up and put it in a little spray bottle. That's what our bodies crave: hydration. We're trying to get something to wash all the mucus out, hydrate the tissues, shrink them up, and start to restore the balance in our mucous membranes.
Well, what is the home remedy again? That's salt and water?
I say, the proportions are about a drinking glass full of warm water and a teaspoon of salt.
Okay.
Mix that up together. You can pour some into a little spray bottle, like the medicated nasal sprays are in, which you can get in the drugstore. You can use an old one that you've emptied and cleaned out, and then just use that, because you can spray it into your nostrils 10 times a day if you want.
It's not harmful in any way.
Not harmful.
There's no effect. Oh, that's excellent.
Yep.
That's very,
and
very
it'll
good
make
to
you
know.
think you're at the ocean, right?
That's good.
Right.
Yeah. Is it going to burn? It might. Okay, well, let's talk about vaccines. Let's talk about, first of all, there are people that may be allergic to eggs, and I know there's some eggs in the vaccine. Is that right?
The vaccine has to be essentially cultured. It's grown.
It's a protein.
So they do that in a medium that contains materials from eggs. So an egg allergy is challenging, because if it's true serious allergy, we really can't use that type of vaccine for you.
Okay. So we're at the end of January-ish. Is it too late to get my flu shot if I didn't?
Nope, because we think that the flu season typically will go through March, maybe even into April.
Really?
So given that we think that the effectiveness of the flu shot takes about 2 weeks after you get the flu shot for it to be fully effective, although there's some protection even the next day.
Right.
It gradually builds up over about 2 weeks as your body is bringing the vaccine in.
Okay.
So given that we've got at least 2.5, 3 months left of the flu season, by all means, still get it.
How about pregnant women? Does it protect them and the baby?
Pregnant women are the most important part of our population that we want to immunize, because it protects them and their baby.
It does protect them and their baby. Okay, so going back to the nasal spray you said to do at home, but I know the nasal spray was available for my kids 2 years ago, but not last year.
So two different nasal sprays here we'll talk about. So what I was talking about was the home remedy of how to clear out the mucus from your nasal passages if you have a cold. The nasal spray vaccine has been on the market for a number of years. Anybody who's ever tried to give a vaccine to a kid will know kids will much rather take a spray up their nostrils than get a shot in their arm. Right. So it's been a real benefit to getting a lot of kids immunized. Now the problem is there have been some times when the message has been, don't use the nasal spray this year.
Right.
And it's not because the nasal spray is bad. It's not because there was a recall. It's because we haven't really gotten into this. But I said initially, influenza is a family of vaccine of viruses. It's a family of them. So we never know from one year to the next exactly which one's going to show up until we start to get some clues.
Okay.
So there are groups who are constantly tracking what type of flu, what strain of flu is appearing in different places. We will typically get strains that have already started to appear in parts of the Orient and parts of Asia. Typically will appear there before they come to the United States. So we have a little bit of time, on the order of about 6 months, to try to figure out what the best vaccine is going to be and to formulate that vaccine. So there have been some years, many years, when either the shot or the nasal spray were perfectly appropriate treatments. But there have been some years, and I believe last year was one of them, when they said, this year that nasal spray is not going to be effective against this year's flu.
Depending on the strain.
Yep,
of the
depending on
flu.
the strain.
Very
Yep.
interesting.
Yep.
Did not know that. Okay, good. So let's kind of talk about. We're gonna give us 5 more minutes. We're gonna go into live questions.
Okay.
But till then, tell our audience how to stop spreading the infection.
Okay.
Important.
This is good. Well,
Yeah.
there are two options, really. You can wrap yourself in plastic. No.
Bubble
It's
wraps.
not, that's got its own downside. Hand washing is the most important thing. If you come into any hospital, into any medical clinic, you'll see people right and left washing their hands. I could do a close-up and show you how chapped my hands are, which is another issue entirely. But if I see 25 patients in a day, I guarantee you I'm washing my hands 50 times in a day.
Yeah.
Because I wash before and after. It is the most effective way of preventing the transmission of wintertime viruses, both the cold and the flu.
Okay.
Now, influenza can also transfer through the air, so you may see people who have the flu wearing masks. You may see people in the hospital wearing masks, because that is a courtesy, because you're also helping that from spreading as well.
Right. And just like I tell my kids, use your elbow when you're sneezing.
Use your elbow when you
Your hands.
sneeze.
Avoid crowds if you can.
Yep.
Okay.
And surfaces too. Remember you
Oh,
said
yeah,
at the
48
start,
hours.
48 hours on surfaces.
Okay.
So, if you're in a place where it's just you, just your family at home, and nobody there is sick, you're probably okay. You don't need to be, completely obsessive about
Sure.
washing surfaces. But if you're in a public space or in a medical facility like this, you'll see us sanitizing and washing the surfaces all the time.
Okay. Speaking of sanitizers,
Mm-hmm.
what do you think about hand sanitizers and antibacterial soap?
Yeah. So depending on exactly what type of bacteria or virus you're talking about, they're usually both effective. Now, part of the problem, we tend to encourage people to use the soap and water more than the hand sanitizers. It does seem to be a slightly higher effectiveness in terms of washing your hands with soap and water. And I think part of that is sort of technique, if you will.
Okay.
Because if people just put a little dab in their hand and they just kind of
Just center of their palm.
Yep.
Yeah.
you're not really getting it where you need to around your
The
fingers, which
water
are going to
will
be
get- okay.
touching everything.
When I hear something about the antibacterial soap or sanitizer can kill all the good germs and good bacteria in our hand, what do you say about that?
I would that it were that powerful, but it's not.
that
Yeah,
powerful.
it's not
Okay.
that powerful. We have bacteria all over us, and when we wash our hands, we will remove the surface bacteria. Within minutes, it'll be back there.
Okay, so to keep your immune system strong and to keep building it up, I'm going to tell you 3 truths and a lie.
Okay.
So you're going to tell me which one it is. So
Okay.
take your vitamin C, eat a good diet, and sleep. What is the lie?
Vitamin C.
Why is that?
It's never been proven to have any effectiveness in terms of raising your immune system.
Okay.
It doesn't prevent colds. It doesn't prevent the flu. It's a necessary vitamin, and there's a terrible disease called scurvy that happens to people who are deficient in vitamin C. So don't get me wrong. I'm not saying it's not important, but taking mega doses of vitamin C, you hear a lot of people saying, "Yeah, well, I thought I was getting sick, took a bunch of vitamin C, went away." That's good luck. Unfortunately, it's not good science.
Okay, so that's a myth. That's very good to know.
Yeah.
All right, well, I'm done with my questions. I'm
Okay.
going to go to our audience with their questions.
Beautiful.
So we're going to start with Darlene. Do antivirus shots work when symptoms start?
Do antivirus shots work when symptoms start? So I'm going to assume you're talking about a flu shot. So that's the main antiviral shot that we have. We usually say to people, it's never too late to get the flu shot. We really don't know. We have testing where we can identify the flu, but if you're starting to get sick, it's not a reason not to get your flu shot.
Right.
If you haven't had it so far. We could question whether it truly would be effective. I said before, it takes about 2 weeks for the vaccine to get really effective. So if you literally had the flu that day and got the vaccine that day, it might make no difference. But the truth is, we don't know going in if it actually is the flu. So we always encourage people to go ahead and get it if they feel okay.
Perfect. And then Sandra, I have read and watched videos on how the flu vaccines mess with the immune system and is causing many other issues. How true are these?
I'm afraid I can't give a lot of credence to that. I don't know exactly what you mean in terms of mess with the immune system. Any vaccine is meant to have an effect on the immune system. That's how they work. What vaccines are basically false viruses or bacteria, ones that are not able to make you sick, that you put into your body to make your body think that you've actually been exposed to it. Our body's immune system has a memory, if you will, so that the next time we're exposed to that thing, the real thing, we're able to fight it off. Immunizations are the heart and soul of how we live long, healthy lives today. The world was different 100 years ago. None of us were here 100 years ago. I encourage everybody to really read the history because I talked about 1918 when 18 million people died in across the world from the influenza. We haven't seen that recently, and a big part of why we haven't seen that recently is because of immunizations, right?
Great. And then Sue, how do you know if an illness is viral or bacterial?
Yeah, it's tricky, and I don't have an easy way. That's why we typically will invite people into the clinic to come and see us, or go to one of our express cares, because I can't tell easily if there could be something in the ears, something up in the sinuses.
You have to be checked.
You have to be checked, yeah. We're doing more and more with telehealth these days, so we have some doctors who are really training themselves to be able to do that through a video interface. Right. But it's frankly, it's a tricky skill, because sometimes I would say I could tell within a couple of minutes of taking a look at somebody quite easily if it's bacterial or viral, whereas if I'm talking to them on the phone, I don't really know the difference. Right. What I can say is that over 90% of illnesses during the winter months are going to be viral, and it's actually the exception that are bacterial.
And then Carl wants to know if a virus is a living organism like bacteria.
Yeah. That's a good question and a hard question, because even philosophers have debated this one. Oh. We typically define something that's alive as something that's able to reproduce, that has a genetic code. Now, viruses qualify on both those fronts, because viruses can reproduce, and they have genes. Usually a virus is just a little tiny protein packet full of genes. What separates it from what we usually think of as living stuff is that viruses have no organs at all. They have nothing. And in fact, they don't even have the reproductive means of reproducing themselves. They just have the DNA code. So what they do is, what viruses do is they find a host, either a person, a bacteria, an animal, and they literally insert themselves into the genes of that host, and then the host actually starts reproducing the virus. So it's always been an argument, sort of philosophically, whether that actually means viruses are alive or not, because without a host, the virus couldn't reproduce and couldn't do anything.
That's very good information. I had no idea. And then Laverne, what is the difference in a severe cold and an actual flu?
There really is no similarity between a severe cold and a flu, because if it's not caused by the influenza virus, it's not the flu. Now, we use these terms a lot, cold or flu, flu-like illness, that sort of thing, because without testing, we can't tell you 100% sure whether it is or it isn't. And we do have testing for the flu. Most of these other viruses that I had mentioned, we don't have a test for it. Even if I wanted to, I couldn't run one off to the lab. So you can be very sick with a cold. You can get a virus that is not the influenza that can lead to complications like a pneumonia. People can end up in the hospital. All that is possible. We simply single out the flu because A, it's typically more severe. B, we have typically seen complications, particularly in these more vulnerable groups, the young and the old. And frankly, because we also have some other weapons, testing and immunization against it.
All right. And that, how long does the flu last?
Flu can typically be 5 to 10 days, we'll say. I talked about 3-day illnesses. I've never seen a flu that only lasted 3 days.
Okay.
So for most people, it's going to be about a week.
Okay.
Sometimes a little shorter, sometimes a little bit longer.
And symptoms vary.
Yeah.
Makes it really hard for you. It's a hard job. And then Barb, why are sinus infections so bad this time of year?
Mm-hmm. Sinus infections are a bacterial infection, and we haven't really talked about that much, except a little bit of compare and contrast with some of these viral illnesses. Big, important point about bacterial illnesses like sinus infections. You can't catch them from anybody. You start out with a cold. What happens is you get a cold, it causes the nasal congestion. Mm-hmm. Remember, that doesn't happen as often with the flu.
Right.
And if your anatomy in your sinuses is such, you may end up starting to get fluid building up in your sinus spaces. Sinuses are cavities in the bones of the face. Those cavities fill with fluid. Bacteria that's already there, all that good bacteria, starts to grow in that warm, wet environment, and then can become what we would medically talk about as an overgrowth phenomenon.
Wow.
So the bacteria that's causing sinus infections is our own normal bacteria that's in an abnormal state of growth.
Okay.
So you've never, here's, one of the things that I try to help patients understand is, I'll have someone come in and say, well, my wife was just, had exactly the same symptoms that I did, and she was treated with antibiotics for a sinus infection. Now I got the same symptoms. And I said, well, whatever it is, you didn't get it from her. Mm-hmm. Now you may have gotten the original virus from her, but you can't get a sinus infection from somebody else. You can't get an ear infection from somebody else. Okay. You can get strep, and you can get all of these viruses from someone else.
So sinus infection, ear infection is not a contagious?
Correct.
Okay, cool. And then Bonnie, have had reoccurring sinus infections.
Mm-hmm.
Do automatic cleaners for PAP machines work? Any recommendations?
So I assume you're talking about then the CPAP. So some people have to wear a mask type device to help them breathe at night for sleep apnea.
I see. Okay.
So so anytime that you have water sitting in a static well, so a cup of water, a container of water, the reservoir on a CPAP machine, reservoir on a humidifier, which happens for a lot of people. That has to be cleaned regularly, otherwise bacteria will grow in there. And it's actually not just bacteria this time, it's funguses, which we haven't even talked about.
Yeah.
But they can get in, that's a whole nother story. Yeah. And these machines are designed to move that water into the air, humidify the air that they're blowing through, and then they literally blow it right into your airway. So you got to clean it.
Keep it clean.
Yeah.
Okay. And then Louis, how do you diagnose a sinus infection? And if you have one, does it need to be treated, or will it clear on its own?
Great question. So I just talked about sinus infections as being our own sort of spontaneous response to another type of infection. So it would always start with a virus, cold, other type of viral infection. So you develop the nasal congestion. In the wrong set of circumstances, it may start to build up in the sinuses. One of the clues that we get, and this is a really important one that I don't know that a lot of people really think about outside of medicine. What we'll see is that virus causes the symptoms, it starts to get worse, actually starts to get better, and then a few days later, that bacteria starts to overgrow. So there's usually a gap, and what this causes is you get ill for a few days, think you're on the upswing, think you're getting better, and then you start to get sick again. Often with a lot of pressure in the sinuses, that nasal congestion is thick and may have an odor to it. One myth I like to bust all the time is that the color of the mucus doesn't mean a thing, because mucus
it does or does
not.
It does
not mean a thing, because if you have somebody who's had a cold for a week, their mucus is going to be green.
I see.
But it doesn't tell us what it's from.
Mean anything. Okay.
But what I just described is that illness that gets worse, gets better, and then gets worse again. That's very characteristic of a sinus
Sinus
infection.
infection.
Yeah.
Very, very good.
To the second part of your question, just like with kids and ear infections, we're learning that we don't always have to treat those with antibiotics. We're learning we don't have to treat sinus infections with antibiotics as well. What's the advantage of that? Well, antibiotics can cause a lot of problems. Sometimes it's yeast infections. Sometimes it's that you're building up immunity. It's not you building up immunity. It's the bacteria
right.
building up immunity to that particular antibiotic. Causes diarrhea, can cause skin rashes, can cause all sorts of other things. So there's always a good reason to at least stop and think, do I need this antibiotic? Right. Everybody wants to get better. We want people to get better. We don't want people to suffer.
Yeah.
You know, most of us got into this business because we're trying to help people, you know, relieve their pain and suffering.
Yeah.
But sometimes it's, you know, we should take a minute and think, is that really going to help me, or is that possibly going to cause more complications?
Sure. And people don't know that. They think they want medicine to feel better. That's why it's very important what you're doing right now is to inform patients and our audience about what to take and what not to. I have Seri Kanth. He's asking, why do so many doctors treat bronchitis with antibiotics when most of the times it's a viral cause?
Well,
it's like you know you're talking about.
Yes. Welcome to my world. So yeah, bronchitis has been proven to be a viral infection. It is a viral phenomenon. There actually was some early research that was a little bit misguided. So people with the symptoms of bronchitis were cultured. They put culture swabs down their throat and swab out their large airways. They grew bacteria and went, aha, it's bacterial. Well, if you swab anything, you're going to get some bacteria.
Right.
So really, it was a misguided effort in medicine. Bronchitis, the itis in Latin means inflammation, and then usually in medical terms it's preceded by the part of the anatomy. So the bronchi, which are the large airways, not the little tiny microscopic airways that are in the lungs, but the big tubes that lead from the lungs to the trachea, to the largest airway. That's all called the bronchial tree. And if you get a virus that manages to get past your upper respiratory area down into the bronchial tree, it's going to cause inflammation. It's a virus like anything else. There's a big difference, though, when it gets down here. And it's not that it's all of a sudden decides to become bacterial, because it can't. A virus can't transform into a bacteria. What happens is it inflames the linings of those large airways. They get swollen, they get thick, and as they get swollen and thick, they secrete mucus, which is why you start to cough stuff up, so it becomes a productive cough. Part of the body's response to that is that it actually sheds the entire lining of your airway, more stuff to cough up.
Sheds, like more fluid adding on, okay.
Yep, and so every time that happens, more stuff, you have to keep clearing it out, coughing. And what you're left with is essentially a naked airway. It's got its outer layer of cells have all been shed off, so it's very sensitive to cold. You see a lot of people, they've had bronchitis and they can't go out in the cold without reactive cough. And it can take weeks to get better from. So I tell people if they've got bronchitis, it's going to last 4 to 6 weeks at a minimum.
Wow.
And
contagious?
Don't worry. Well, it's contagious like any virus at the early parts.
Okay.
Probably most before you even get sick.
Right.
But after a week or 2 weeks, not at all. Okay. And people are very disturbed. They think understandably so, that they think they've got this persistent cough. It's got to be something terrible.
Yeah.
But if you know going in, this is bronchitis, you're not going to feel well and you're going to be coughing for 4 to 6 weeks. Sometimes it just helps, and people can say, okay, I just got to take my time and get better.
Yeah. Good.
Yeah.
Stella is saying that she had bronchitis in November and then got it again 3 weeks ago. The x-ray showed my lungs were inflated. Never heard that before. Okay. What is inflated lung?
Well, that description, as I understand it, has nothing to do with bronchitis. So I don't know anything about your medical conditions, and I don't want to make any assumptions. But that description of an inflated lung, which the term would be actually hyperinflated, is a sign that we see often with COPD or asthma. Okay. So people who have both of those are called obstructive airway disease. They lead to taking deeper breaths than usual all the time, and that you can breathe in more easily than you can breathe out, which is why both of those cause wheezing. That's the result of easy in, hard out.
Okay.
And so what you see on an X-ray picture is that the lungs have a typical shape with a round diaphragm, and what we'll see is that chest is slightly expanded, that diaphragm is flattened, and we describe that as hyperinflated. So I think that's what they're talking about, and I'm afraid I can't answer any more specifically than that.
Okay, and then we got Mary. Any suggestions for natural remedies for cold and flu?
Well, the one I always go back to is the one I talked about, which is the nasal saline spray. A little bit of salt water goes a long way.
Yeah.
I say salt water because pure water, tap water, it's actually going to tend to draw out the salt from the tissues. There's nothing wrong with it. It's not harmful. It's not bad to use plain water, but it doesn't do as much to allow the water to pull into the tissues.
Okay.
So chlorinated tap water can be a little drying if you expose it right to your nasal membranes. The salt water tends to make it a little easier, feel better, and actually be more effective.
Yeah.
So that's my number one natural remedy. There's really not been research that has supported, we already talked about vitamin C, other types of natural products, flour products, and so forth. There's nothing wrong with things that make you feel better, like menthol. A lot of products for colds are mentholated, the old Vicks Vapor Rub, or other things, nasal inhalers now, aromatherapy. If they make you feel better, there's nothing wrong with them, and they're not really harmful.
Okay.
They're just not going to cure anything.
Okay, so my mom used to make me take a spoonful of raw honey and then take like a shot of squeezed fresh lemon after.
Okay.
Does that work?
Yeah, I mean, again, so the honey is soothing. So,
Yeah,
so
for the
you know,
throat.
if you have a sore or raw throat, it's going to be soothing. Lemon, you know, it cuts through. It's acidic, so it cuts through some of the mucus.
Yeah.
To me, it's a question of, does it make you feel better? If it is, and it's safe, by all means.
Okay.
Hydration is, you know, of any of these materials is good, because you can steam something with a little eucalyptus or a little honey or a little lemon or something like that,
Tea.
or drinking it in tea. You know, those all feel good and they hydrate. So, so the honey may be more, you know, like coating the problem, but if you hydrate and coat, you're going to get better.
Maybe just a placebo effect.
Maybe. But who's complaining?
Right, not me. Right. Carl, why do we take medication to bring down a fever when the fever is our body's method of defense?
Yeah, so I tried to get into that before. It's a little hard to understand. The biggest risk of a fever, especially if it goes very high, is dehydration. So your body is literally hotter than it is, and it's going to burn off, or it's going to evaporate more fluid more rapidly. There is a little bit of a risk for kids. If that temperature goes up very fast, that could lead to what's called a febrile seizure. So we always try to mitigate it. Most of the time we're not trying to eradicate the fever, because it is part of our immune system. We're trying to get yourself more comfortable so that you're not losing as much fluid and can sleep and rest and therefore get better faster.
Okay, and then Joanne wants to know if strep is unusual in adults.
Yeah, we see it less in adults than we do in kids.
Okay.
And I'm afraid I'm not 100% clear on the reason for that. It doesn't seem to be an accumulated immunity like we see in some other things. So you know, there certainly are many illnesses that we see more commonly in children than in adults. RSV I gave as an example of one.
Right.
That seems to be, you've just been exposed to it enough. I think, frankly, it has to do with the fact that adults don't stick their fingers in their mouth quite as much as kids do.
Right. The dirt doesn't go. Okay, and then Misty, is hand sanitizer as effective as washing hands?
Yeah,
we'll say no.
We'll say washing the hands gets that one by an edge, and it probably isn't actually about what's in the cleansing material, the soap versus the gel, but how effectively you're actually getting every surface as you're washing your hands.
Great.
So.
Well,
Okay.
we're out of time. We're all set. Is there anything
Well,
else
that
you want
flew
to add?
by. No. Just get your flu shot because
Yeah, wash your hands.
and wash your hands. We want to keep each other safe and comfortable this winter season.
Well, it's been a pleasure. And if you do want to make an appointment and talk to Dr. Ford, you can call 866-320-4573, or you can go to www.clevelandclinic.org/Medicine Institute and make sure to check out all of our other interviews for practical health advice from Cleveland Clinic experts on our Health Essentials podcast at www.clevelandclinic.org/HE podcast. And of course, for more health tips and information, keep following us on Facebook, Twitter, Instagram, and Snapchat at Cleveland Clinic, just one word. Thank you. We'll see you again next time.